Welcome to our presentation. My name is Joanne Brooke, and this work has been completed in collaboration with Monica Robatska and Anita HUGHES, and we all work at Birmingham City University. This is a very short and brief overview of the work we've completed to develop a framework with the aim to support the development, implementation and evaluation of initiatives for prisoners with dementia. The prevalence of dementia in prisons is increasing, so it's an important topic to address. The prevalence of dementia in prison setting is increasing due to the ageing prison population. The prison population is ageing very much as our community populations are ageing, but also due to harsher sentences back from the 1980s and the longer prison sentences, but also developments in technology such as DNA testing, and more recently with historical crimes coming through the criminal justice system, especially those regarding sex offences. So you could have a prisoner entering the prison system in their 70s, 80s, 90s, and even past their 100th birthday. So therefore, the prisons have to create new initiatives to support these older people and those that might be developing dementia or have dementia, which are very different from the initiatives for younger prisoners, which is focused on rehabilitation. Therefore, we found the need to develop this framework. So our methods for developing this framework, we decided that we really needed a robust method. So we took to the theoretical literature and we looked at the work of Lee and colleagues, Toit and McGrath, who looked at social care for prisoners. And we took their work and looked and evaluated their work and found these 4 components that would fit our framework. Firstly, the environment. Very important in a prison situation, but not only the environment of the prison, but the environment where the initiative was being held, particularly if older people could get there. Education we found to be very important. Although health and social care professionals and prison staff are receiving education regarding ageing prisoners, this doesn't necessarily include dementia. So that was important for us to include. Thirdly, meaningful engagement. We found that we wanted to include meaningful engagement so that initiatives weren't being implemented that just enabled older people and those with dementia to leave their prison cell. We wanted the engagement to be meaningful and support their cognitive abilities. Fourthly, collaboration and support. There are many institutions that go in and out of prisons to support prisoners, including charities, voluntary organisations, different companies. So we wanted to ensure a robust collaboration support, including health and social care and prison staff. So we had the basis of our framework, but to develop it and test it further, we took 3 initiatives that we knew had been positively evaluated and implemented. And these included True Grip, Special Needs Programme for Inmate-Patients with Dementia, and Gold Coats, all delivered in America. So our final framework has been developed. So environment has a further 6 components, which picks apart the different physical environments that would need to be supportive of older people and those with dementia. Education, again, had 4 different subcomponents. And this was to look at the training and education of staff and prisoners across the board to support the recognition of dementia, symptoms of dementia, and how to support someone with dementia, which we thought was very important. And again, meaningful engagement. This had a further 6 components, again, to really pick about what activities would be supportive and how could these support cognitive abilities of older people and those with dementia. And lastly, the collaboration and support. This had a further 4 components to ensure that we were working with all the different agencies. So in conclusion, the framework, although I've given you a very brief outline, we hope and aims to support the development, implementation and evaluation of initiatives to support prisoners with dementia. And the evaluation is equally important to understand the fact that we are supporting our older prisoners and those with the dementia in a positive way. And we can only do that with evaluation. So the framework is obviously a lot more work to it than I've explained in this very short presentation, but it is there to be used within prior to the concept of the initiative, right through to evaluating an established and implemented initiative. And we really hope that it will be used in this manner to support these initiatives to be based in evidence-based practice. So thank you very much for listening to this presentation.